Good morning, everyone. This is Sandy Marrero with Western Marketing. Thank you very much for joining us today. We have a treat for you. We have Allstate benefit and Allstate ancillary product. With us, we have Sean Brown, which is the ancillary product representative for Allstate benefit, that is going to give us a little bit of information on how their those products work in combination with major medical group. And then after him, we're going to have Chris Novak from the self-funded, level-funded side of the Allstate benefits. Without further ado, Sean.
All right, thank you, Sandy. Yeah, Sandy, thanks for putting this together, and everyone, thanks for hopping on. Like Sandy said, I'm the ancillary specialist here, working right alongside Chris with all of our ancillary products. So I'm just going to take you through a brief, introduction of the two main carriers that we use for our products and the slight differences. What sets them apart, the perks, and then what we need to do a quote for you guys as well. So the main carrier that we use for our dental and vision is Beam. What's great about Beam, first of all, is that we are their largest distributor. So we're really helping them grow. So we do have a lot of pull with them. We also have direct people to reach out to get answers, to ask questions to get anything that we may need. So just to kind of highlight a couple things with the network for dental, they actually use, it's three main networks, DBP by UHC, Carrington, and Dentamax. We also do have First Dental Health, but that is really just in California. But all three of these networks work simultaneously. Whenever I do get a quote from a broker, from one of you, I will check to see how many dentists are in a given area to make sure that we're picking the best plan. Whether it's a UCR plan, which is usual, customary, and reasonable, that those plans allow for great out of network coverage, so they work best in areas that are maybe less populous, more rural. We also do have the MAC plans, which is maximum allowable charge. Those plans are less expensive, but the group needs to stay in network to avoid balance bills. So I will include that information of how many dentists are within a certain mile, and then give my recommendation, and then I can always send a link as well to show which dental practices are in the area, or if you'd like me to search it, I can as well. For vision, we use one of the largest networks, VSP. We have plans that allow for frames every year, every 2 years. We have different maxes in terms of 130, 150, 180 that they may receive. For dental, our plans for the annual maxes start at 1,000 in increments all the way up to a $5,000 annual max. So again, a lot of leeway there. We can show many different options. Just so you know, Beam will cover 1099s, retirees, domestic partners, and we can do dental and vision down to 2 lives. We can actually also do orthodontia down to 2 lives. So, and they do have to be unrelated. We cannot have just a husband and a wife company. So just to let you know. Beam does integrate with most admin systems like Ease, Employee Navigator, whatever you may be using. One of the unique things about Beam is that every enrolled member receives a free sonic toothbrush, and they can actually pair that with an app to track their brushing habits. Now, the toothbrush actually can goes to the employee, spouse, any children. So, it's really a great thing for kids to track their brushing habits, make sure they're brushing their teeth, everything like that. And I've been using this since I took over this role about 9 months ago, and it's one of the best ones I've used. And if any of you would like, I can also send you a free toothbrush if you would like at the end of this presentation. All right, so I'm just going to go quickly into the Beam score, the reason for the toothbrush. So if the employee group would like to download an application, they can actually, like I said, track their brushing habits. The reason this helps is, one, you can see how you're brushing. Are you doing it long enough? Are you doing it frequently enough? But if they do track this, they can actually save money on their renewal come the following year. And if they track enough, they can also get gift cards to things like Amazon, Starbucks, things like that. The group does not have to download the application. They can just use the toothbrush as it is. But again, if they would like to potentially save money on their renewal, it's a great option. Beam does also offer toothpaste, they do floss, they do hand sanitizer, a lot of nice little things that way. And we can always make sure that they're getting the brush heads, things that they need. So with Beam as well, to quote a group, what we really, all we need is a basic census, SIC code, zip code, and how many employees. We do not need applications, and there isn't like a group application that needs to be signed. We have an enrollment census that is just an Excel file with some highlighted information, and then I will submit that, and I will always help walk through these points of sales, make sure it's smooth, and make sure that everything is good to go. Also, with Beam, the commission does start at 10%. With Western Marketing, though, it actually is at 11, but we can hire that all up to 20% based on your request. The other main carrier we use for our ancillary products is Nippon Life Benefits. If you're not familiar with Nippon, it is one of the biggest ones, a subsidiary of Japan-based Nippon Life. You can see here number 125 on Global Fortune 500, A- and best rating. They do offer bundling towards dental, and it uses us as largest distribution channel as well, and voluntary or employer paid plans. And you can see here the different products that they offer as opposed to Beam. So I will pivot to Nippon in a few situations. One, if there's one of the very few states that Beam does not have access to or benefits in, or if the group would like all 5 lines. So dental, vision, life, short-term, long-term disability. So you can see here, just starting at the top, the dental plans, very highly customizable. We can go down to 2 lives. Orthodontia available as well. UCR and MAC plans, just like Beam. And they do actually have a few different networks to choose from. So we do have the Aetna Dental Administrators, and we also have Dentamax as well. And with Dentamax specifically, I know they have 87,000 providers across the country. For vision, they do use iMed as the main network, which again, you can see 91,000 total providers. We do have the copay plans, voluntary available as well. And what's great about the Nippon Vision is actually they can allow for frames and contacts every year, every 2 years. With Beam or most other ancillary providers, it's one or the other. With iMed, we can actually do both each year. For life, we can do it available at 2 lives. For standalone life or disability, we do need at least 5 enrolled. If it is under 5, we do need to add at least 1 more line. But you can see the guaranteed issue for all sizes, 2 to 9 lives, 10 plus lives, 50, 100,000, 2-year rate guarantee. We also have supplemental and dependent life available. We also have the accelerated death benefit, waiver of premium, and this is a portable option for voluntary plans, so they can take it with them if they would leave the company. And for disability, for short term, we have the 50%, 60%, or 66 2/3 of earnings. Generally, we will lead with 60%, but if the group would like 50 or 66 2/3, you would just need to let me know. Guaranteed issue, 1,500, max weekly benefit up to 2,500. We can go down to 1,000 as well. So it also is a very nice product in that sense as well. Benefit duration, 13, 26, 52 weeks. And we always try to pair the benefit duration from short term to lead right into the long term. So we will always try to make sure that those are together. For long-term disability, again, same percentages there. Maximum monthly benefit up to 10,000. We may need some underwriting done at that point based on the SIC code and what they're exactly looking for. And the elimination period is 90 or 180 days. Now, this is quickly just going through the portals that we use. So with the group health or medical, we use Ally Financial. With these products, Beam and Nippon, Beam has theirs called Lighthouse. When a group is sold, the group contact and also the broker will have access to Lighthouse, and I will as well. What's great about it, it's very simple to use. If you need to add or terminate an employee, very simple. If you need to print off temporary cards, if you want to make sure that all the dependents are on there, you can definitely do it at any time. You can also view your invoices. And what's also great about Beam is when a group is in force, there is one person who handles that within Beam. So if you have questions, you can email them, you can email me. it's not going to be a carousel of people you may be talking to. It's going to be one person. And again, always use me as a resource to make sure that we're getting the answers for you or for the group. And Nippon, very similar setup, very simple to use for adding term and employees, invoices, things like that. And now for the quoting process, like I mentioned before, for Beam, we see the name of group, zip code, eligible at SIC code. For Nippon, for dental, life, and vision, we see a census with name, date of birth, and gender. If they are looking to add disability, we will need salary information and actually their job roles as well. The one thing I will also say is that with our ancillary process, specifically dental, if the group is also quoting medical with Chris and they would like to add dental, there actually is a multi-line discount. So they can actually receive 2% off of the administrative fees on the medical side. So save a little bit of money that way. If they would like to add voluntary benefits, that will actually raise to 8%. So pretty good savings for those groups. And the voluntary benefits would be handled by someone else within Allstate, but all three of us will work together to make sure everything is submitted correctly. And then Chris would complete that multi-line discount. If you would like, when this is done, for me to send, some quick highlights, some underwriting guidelines, the multi-line discount, anything like that, when this is done, please just let me know and I will make sure to send that off to you. Then we can have another conversation about a specific group, anything like that. But to be honest, that's really it. The ancillary side of things, I mean, it's been great so far. One thing with Beam I did forget to mention, if we do have their current renewal, I can go back for rate relief, and it's been a very great process so far. They want these groups. And also right now on groups 10 plus, we are getting an extra 6% off of the premium. So I can also submit that at the time as well. And like I said, use me as your resource. Any questions you may have, if you want me to discuss this with a group, let me know. I'd be more than happy to talk to them, answer any questions. And also with how simple the ancillary process is, I tell all my brokers, focus, if they're quoting medical, focus on the medical first. We can get this done very quickly. We need a lot less information to complete a group, but just bring me in when needed, and we can get this done within a couple days. So we will definitely make sure to get done. Chris and I can work together. But other than that, that is our ancillary products. And like I said, if you have any questions, please let me know.
Thank you very much, Sean. I appreciate it. I will have time for people to ask questions at the end of the webinar for both you and Chris. But please do keep. I'm gonna set up. I'm gonna give the opportunity to Chris now to get his team ready. Christopher Novak with Allstate Benefits is going to be presenting the wonderful world of the small group side. So just giving a few minutes and then we go from there. Chris?
Well, hey, can you hear me first of all?
Yes, I can hear you.
Perfect. Okay. I appreciate everyone's time today. I apologize for my camera not working. We just set up these new rooms for doing Zoom meetings, and the camera apparently doesn't want to work, but that would just distract you because I have a pretty ugly face, and I don't want to take away from what we're really trying to accomplish here, which is, in fact, some small group health insurance and ancillary dental, vision opportunities that we can provide to your employers and create a solution for them that many times they have not heard of because the name Allstate Benefits has only been in the group health business for about a year and a half now, 2 years. However, the product itself is a much older version of that. It's just a new name of Allstate, which we really enjoy having, by the way. So just going through
Chris,
the agenda.
Sorry for the sorry. Could you just make you have both of the slides on? Could you make give us the full version of it, if you don't mind? If you go to the settings.
Oh, is it on the wrong screen?
The displays. Yes.
Go
to display settings.
Go to,
Um,
where am I going?
Go to the display setting on the top. You have your show display.
Show display. I don't see a show
Show.
display. Sharing. Stop sharing screen for a second. Show
All right.
screen.
Thank you very much. Well, like we apologize for the delay
There we
on
go.
that. So there you go. Perfect. Thank you.
All right. Yeah.
Go ahead.
All right. Thank you. So just going to go over a little bit about who we are, where we came from, products that we're offering, the quoting process, submission process, and actually I should have taken the welcome email info out of there because we're not going to talk too much about that. Allstate benefits, again, I just kind of mentioned, I prefaced this now, where Allstate benefits is in the small group health world, where it actually started, all the way down here at American Heritage, Time Insurance, John Alden Fortis, Assurant Health, most recently National General Benefits, and now I think we finally found our final resting place at Allstate Benefits. So we have been welcomed here. We've been truly, we've gone from, we'll see what we're going to do with Allstate with the group health side of things at Allstate to we want nothing more than to bolster this and turn this into something great. So really excited to be part of Allstate and what they have in mind for us and for you and your clients. So we're going to get into the level funding. So what we are offering is a little bit different than the fully insured side. So as you're looking at level funding, some like to hear it called self-funded. So you'll see those words here on these slides, partially self-funded or level funding. What it does is that with fully insured, the traditional plans, the gold or the metal plans, I should say, that a lot of carriers are offering, those are community rated plans. So it's usually taking either a region or a state as a whole and bucketing all of those people into one single bucket. What we are offering with the self-funded product is the ability to be treated as your own group. And I'll get into the kind of the basics of what I mean with that. But that is the ability to underwrite. So prior to the Affordable Care Act, you had fully insured, everything was a fully insured plan pretty much. There were a couple of states that had the self-funded products that were working pretty well, but everything was fully insured. It was still underwritten, and they were treated similar or pretty much by yourself, but there were caps to how much a carrier could increase rates off of their standard rates. So that was really just a tolerance for a bucket of groups, but you could still be treated somewhat individually. Level funding gives us the ability to underwrite a group and treat a group individually, offering them stop loss insurance and a claims account. Okay, the claims account is what's really cool about this product, and we're going to talk about that in just a couple of seconds. So I've mentioned a couple times now medical underwriting. That is what sets us apart from the fully insured side. We do take employee applications, and I do have some big news here that I'm sharing hot off the presses on this presentation about simplified underwriting where apps are not a thing. We don't have to use applications, but we still will be underwriting. We do have the ability to refund, okay? And this is based on the group's utilization of the actual benefits. Again, we're treating these groups individually rather than as a whole state or a whole region of the United States or region of a state. We offer savings, and that comes in the form of underwriting, which gives revenue to the employers. It saves them on the revenue side of things, and it also increases your revenue because we pay really nice commissions. Also, and most importantly, I would say that we have the ability to offer options. Of course, in these metal plans, you have the bronze, silver, gold, and platinum plans. And there's usually a bucket of 5 or 6 plans in each of those levels. Here at Allstate, we have the ability to create tens of thousands of plan options for the employer. So we can show an employer exactly what they want to see or very close to what they want to see by manipulating the plans to make them a little bit more benefit rich, or maybe a little less benefit rich. This is going to be for group sizes of 2 to 300 plus enrolled employees. And the reason we say 300 plus is because we do have an appetite for those larger groups, and actually our appetite for the larger groups are getting greater and greater. So that number is probably a little underestimated at this point. I'd probably put that number more like the 2 to 500 plus enrolled employees. All of our plans are customizable. The group space that I personally work in is the 2 to 50 enrolled employee space. 51 plus, I would have to get you over to one of my colleagues, Corey Wernland, and he would handle the 51 plus enrolled employees. The meat of the plan looks, acts, and feels just like what I'm going to talk about here today, but there are some different aspects to the 51 plus space that I would want him to give you the rundown on to make sure that it's being conveyed appropriately. We do have flexible participation. So when it comes to groups that are maybe don't have a ton of participation, we actually are very flexible in how we offer that. We would do 50% of all eligible or 75% after valid waivers. For an underwriting consideration, so we may increase rates or maybe even decrease rates a little bit, depending on our appetite for the group. We will lower the thresholds to 25 and 50 for those two buckets. It's easy to understand the 50% of all eligible employees. For the 75%, I'm sorry,
I apologize, Chris. Are you moving is your screen moving from page to page, because we're still on the agenda brief history level funding?
Yeah, mine's moving over here.
There you go. Sorry about that.
All right. Should I roll back a couple pages just to make sure everyone can see what I was talking about?
Yes, please.
Allstate benefits. This is kind of the history of where we came from. If y'all can remember that quick discussion I had with you on that. And then just the talking about traditional funding versus level funding. Okay. And what we're going to see as things kind of move along. The 5 big differences of what level funded is versus fully insured, which is the ability to underwrite, the refund capability, the savings that we can offer, the revenue, which is again for both the group and for the agent, and last but not least, the flexible options. And here's where I landed, and this is where we should be picking up from. So as I was saying, the 75% after valid waivers, if what we're talking about there is if we take the pool of only those employees that are eligible, not part-time employees, not seasonal employees, we're talking about full-time eligible employees. If we have 75% after valid waivers, the way that we do that is simply by subtracting out those that have a waiver for a valid purpose, meaning that they have health insurance elsewhere, they're on the spouse's plan, they're on the ACA plan, maybe they are under 26 years of age and they're on their parents' plan yet. Those are all valid waivers, meaning they have credible coverage elsewhere. We peel them out of the eligible pool, and then it's 75% of what's remaining. So if we have a group of 10 enrolling employees and there are 2 people that have invalid waivers, we easily hit that 75% waiver status to meet participation. We are also offering flexible hours. So if a group wants to consider 40 hours a week as eligible versus the ACA 30 hours, they can do so. They can also set that number lower, maybe to increase participation, down to 20 hours per week. The employer does need to contribute 50% of the employee-only rate or premium. We will take on any industry. We are industry agnostic. So if there's a oil drilling, we'll take them on. We'll take on somebody who's pushing paper. Very simple things. Anything, any industry that you can bring to us, we will insure. Virgin groups we do work with. Multi-location groups we really like. As a matter of fact, if they have locations in other states and they have at least 3 lives on the plan, we will actually discount the premiums by 5% because we like groups that have multiple states involved. We also offer groups of 1099 employees. If that is a W-2 1099 employee mix, that's fine. If it's a group made up only of 1099 employees, we will also do that. We do not offer husband-wife only groups. If they have additional employees in the business and they are the only two enrolling, we will. We can get into those as those opportunities come up. And again, we do have carve-out capabilities. So really what we're saying here is we are very nimble, and we are willing to really create an opportunity for an employer who wants to offer group health benefits to their employees, the ability to do so without too many barriers to being able to offer that. We've got multiple different plan availability options. So traditional would be simply what we're talking about there is our network options. Our advantage is the exact same thing, except we take the out-of-network benefit out altogether. So there's no out-of-network benefit. That would be on the employee to pay if they do go out of network. Core value or reference-based pricing it's a really cool way of carving out networks altogether and keeping rates, not only rates, but also actual treatment. So if you go to a hospital and the doctor office visit is, let's just say, $1,500, and reference-based pricing says, which is Medicare rates plus percentages, so Medicare plus 30 or 50%. If it says that it should be a $500 visit, we will upcharge that to 130% of 500, and that will be the price for the employee instead of that $1,500 bill. So it's a really cool way of not only saving the group money because the premiums are lower, but also the employee money because their pricing of their actual care is significantly lower. Core value flex and core value access flex is the ability to pivot to a PPO, one of the traditional plans mid-year if they aren't comfortable with that reference-based pricing after experiencing it for about 6 months. Core access is in order to just create a little less noise, it has a network for specifically physicians included within it, but it's still core value pricing otherwise. And last but not least, Allied Advocate, which is essentially a traditional plan with we just pay certain claims a little bit differently, and our advocates reach out to the employees in order to notify them that something's going to be a little bit different, so keep an eye out for the bill just to make sure it looks correct. Some new things that we have with our products is MeMD. This is actually a really cool thing, and it's going to be getting rebranded. It was recently acquired by Walmart. I believe it's called Walmart Health. So the name, I don't recall what that actually is going to be changing to, but currently it's still MeMD. This offers 3 MeMD urgent care visits per individual per month. So if somebody is feeling like they want to not get up out of their bed because maybe they don't feel very well, and they want to go see a doctor to talk through what's going on, they can do that up to 3 times per individual per month on the plan. So it's telehealth. It's very cool. Another thing that we really, really like having here is the talk therapy visits. This is for 18-year-olds and older that are on the plan, whether it's a spouse, a dependent, or employee themselves. 5 visits per month per individual. And so if someone needs to talk through maybe some emotions that they're feeling, or they have some anxiety, some depression, or if they just want to talk to somebody about whatever it is that they want to talk about, they have that capability to talk with talk therapy. These plans are only $6 per employee per month with the network plans. And for those that are on copay plans or non-HSA plans, it's a $0 fee when they do these visits. If it's an HSA plan, because there can't be a first dollar benefit, it's only $38 for these visits also. Pretty cool stuff. We do have an activity tracker. So when a group is completing applications, usually if they do that online, they can enroll in the activity tracker. If when the plan starts up, they connect up, we will offer a 5% discount on the premiums. That will show on the initial sold rates. It will not be something that is changed after the group goes into effect. Some more things that we are adding in or have added in, and Sean just talked to you a lot about this, is the dental and vision. We do have the ability to offer a self-funded dental and vision product within the level funded platform. It is on one single bill. However, I will always point you first to Sean. He is our dental and vision specialist, and he will be the guy that will lead you down the right path. And his options, frankly, almost 98% of the time are going to be better than what I can offer within the product internally here. Healthcare Blue Book is for groups with core value or core access, anything that has the reference-based pricing inside of it. This is a really cool thing to offer, and it's free with those. It's part of the product. What it does is it helps employees and groups steer their employees to providers or doctors that not only one accept the product, the reference-based pricing insurance, but also it's a really cool plan to show the employees what they're actually going to go get seen for, what the cost of it is, and it gives this on a stoplight scale, so red light, yellow light, green light. And the red light means that maybe they cost a lot, okay? But then they also have on the backside of that a red light, yellow light, green light for outcomes. So if you're going to get a hernia surgery and you go to a high cost provider that has low outcomes or poor outcomes, why would you pay more for treatment that is worse? You could go to a lower cost doctor that has better outcomes. And so that would be a green light scenario. Obviously, you can figure out what the yellow light is there, but it's really cool because it not only shows you who accepts the product or is lower cost, but it also shows you their outcomes, which I personally am a big fan of, because why would you want to go to somebody who has poor outcomes? It just doesn't make sense. And last but not least, I've touched on this in the beginning, we have a simplified way of underwriting, which I'm going to touch on more here in just a few moments. So we've talked a little bit about the product itself. What I want to get into now is just our quoting process. Quoting process is very simple. It takes about 2 to 4 business days. Particularly, it should be more like 2 days currently. During the fourth quarter, that's when it gets to that 3 to 4 business days before a quote is turned around. And that is purely because of the amount of volume that is coming in during the fourth quarter. And obviously you have most groups that are shopping for their January 1 effective date. And that's where the bulk of the work that we do is. We'd like to shift that throughout the year if we can. So start talking to your groups and employers and find out if they're willing to make a move early. We do offer deductible credit. For those preliminary rates, it's a very simple ask of us, of you folks and the groups, and that is just a census. I don't need anything crazy in terms of a very specific spreadsheet completed to run a generic quote. Okay, I need genders, dates of birth of the employees, their spouses, and their children if they are going to be enrolling. We need the group's name, zip code, nature of business or SIC code, and if you have it available, a renewal or any competitor information is key. It helps us create a quote that is tailored to what the group is currently offering, instead of showing 3 other plans that have nothing to, or that are in no realm of what they're currently offering. So we're looking at apples and oranges, and it's kind of hard to sell when you're talking apples and oranges unless that's your approach, that you want to move them towards a different plan design or something to that effect. Once we get that quote out to you, if the group likes what they see, we will get firm rates. The 2 to 5 business days, again, the earlier side of that, the 2, is more what we're looking at right now today. And as we get into the fourth quarter, it could take up to 5 business days to get underwriting complete. Last year, underwriting did a fantastic job of getting things turned around, generally speaking, within 3 business days. So that 5 is really an under-promise, over-deliver opportunity for us. And that's something that we want to also convey to your clients, and which are hopefully going to become our clients as well, and over deliver to them. During the fourth quarter, we can accept applications for up to 120 days past the time that they sign. So if an employee fills out an application on October 4th, their applications will be good all the way through January 1st. During the fourth quarter, however, or outside of the fourth quarter, quarters 1 through 3, we do have a 90-day window, just because, again, there's a little more time and energy that's able to be put into those groups and get them to move a little bit quicker. Competitor apps, we do accept very few of them. If that's the case, we do need an Allstate authorization form. We do accept Easy Apps, eHealth, FormFire, GoWell Benefits, UBenefit, and BellaPoint applications. So if you are an agent who is using these platforms, our applications are out there. We can use those. We do accept e-signatures. So if somebody wants to fill out an application online and they do use Adobe DocuSign or Adobe Sign or DocuSign, and you see the rest of them down here, those must be in there. And we must have, most importantly, kind of what I like to call the fingerprint page that comes with those when they do use those e-signature capabilities. So we need that page that says, hey, this was on this server, this IP address, and so on. Moving forward, this is probably the most exciting thing that I can talk about today, and that is the ability to underwrite without applications. You'll see here I have two different sections, Simplified Underwriting 1.0 and 2.0. 1.0 is what you see here. It's for all of these, I should say, is for 20 plus enrolling employees, and it's specific to each of these states also. So we do not need apps. It's for 20 plus enrolling employees. So there has to be at least 20 employees on the prior carrier bill that we are looking at. If there are 19, I might be able to catch an exception. I have not been successful at that yet, but in certain cases we might be able to. 20 plus is really the rule of thumb. Let's try to run with that. This is available on all group health products, meaning core value, network plans, and all that. There are some limitations in some states as to the plan designs that we can offer. So we would have to, on this 1.0, we can offer this all plan designs from a deductible as low as $500 all the way up to $6,600 or whatever the top end is in today's world. With that, we will need self-funded claims report. Okay, so the group is generally going to have to come off of another self-funded plan. Usually that's going to be Allsavers. Allsavers does generate the reports that we need to be able to see. If you are in Texas, there is a law called HB 2015 where an employer, where a carrier does have to provide health claims history, or high claims reports. So those are things that Texas, HB 2015, you should have access to at any point in time. In basically every other state, we need them to come off of a self-funded carrier. Generally, again, Allsavers, who offers the data that we're looking for. In addition to that claims data, we need census, and I have a specific census form. So if you have an opportunity, please let me know so I can get that census form to you. An employer disclosure form, which again, I will get to you. Their current bill and their current plan design. All of those things should give us what we need to underwrite the group without having to get the 5-page application completed. Underwriting 2.0. This one is really big and really exciting to me because not only does this not include any apps, but we don't need any claims data either. So it really simplifies that process down. Again, it does need to be 20 plus enrolled employees. We need that same census form. We need that employer disclosure form, a current bill, and the plan and the current SBC. So if you notice, the only difference between these two is not only the states that it's available in, but on the top, where we call it Simply Written 1.0, is the need for claims data and a high claims report. On the second half, we do not need that high claims data or that self-funded renewal. If it's a fully insured group on a bronze plan, on a gold plan, what have you, those groups, if they have 20 plus enrolled employees, they complete the census employer disclosure form, current bill, and SBC, we will run a quote and we will get you a firm rate off of just that information. This is really exciting and really exciting for Arizona, Michigan, Minnesota, Oklahoma, Utah, Georgia, Illinois, Nebraska, Pennsylvania, and Virginia, particularly. Once the group is ready to go, they look at our final rates and they say, we really like what we see. Here's the employer paperwork that we would need to get done. We send this checklist off to every single group when they are getting ready to go. Speaking of which, of the items that we need in order to get the group implemented. Generally speaking, once we get this back, it should take about 24 hours for our underwriters to go through all of it and spit back anything that they need from us, if they need anything more, or get the group sent off for implementation. The implementation process does take about 3 business days. And then from there, a welcome email generally goes out within 5 to 7 business days. Right now, our third-party administrator is pumping that out within 3 to 4. So they're on the early end of that today. Allow 7 to 10 days for the full complete setup of the group. And what I mean by that is it takes a little bit longer for the pharmacy benefits to be turned on after that welcome email is received. Usually takes about 3 business days after. The group would get access to their welcome email and then will be able to access their own web portal a full day after the welcome email comes out. The group does need to go online to pay their invoice at this point or send in a check. And we can go over those options after a group is sold. You, the agent, will also get access to that group on the Allied web portal. And any changes that need to be done, any demographic changes or anything like that would need to be done on the employee app and then sent in. That is going to be changing in the very near future. Groups are going to have access to a new portal, which gives them the capability and access to not only change things within the plan, they can add people, terminate people, and they can see kind of live where they are in that process after they submit those changes. Agent portal is going to be coming, we think, later this year, maybe closer to 4th quarter, which we wish they would get it out a little sooner, but the sooner they can get it to us, the better. It makes everybody's lives easier, mine, yours, and the groups. In certain states, we do offer fully insured rates and plan designs. So I talked about how we want to go self-funded. We always want to take a look at that first if we can. There are 3 states that we have the ability to offer fully insured plan designs in, and that's Florida, Texas, and Indiana. There's no medical underwriting. Nobody can be rejected due to pre-existing condition, again, because we're not underwriting. It includes all 10 essential health benefits, including preventive and wellness, at no cost to the members, guaranteed renewal. Plans are non-customizable, like I mentioned. They are very stagnant. They are what they are, and so they have to choose a plan that they think that they would like out of our coffers. And we are only offering this on groups of 3 or more employees, and we do have participation requirements of 75%. Here are those plan designs. As you can see, we have quite a few, focused mostly on that silver range. And even a little bit into the bronze. That's actually surprising to me as I continue to look at that. I always felt like we were always more of a bronze and silver carrier, not necessarily gold. That being said, I think this is where probably most groups are going to live, is in the silver world. Key contacts, Sean Brown. Sean, you can correct me if this phone number is incorrect, but I think everything else currently is true. Mid-market rep, Corey Wernland, John Johnson for voluntary, and our support team for just general customer service needs. wrap this up just saying thank you to everybody. Really appreciate the opportunity to talk to you a little bit about our group health product. And truly, at the end of the day, and this goes for both me and for Sean, if there are any questions you ever have, if there's a group that has any interest, if there's an opportunity, the best way to take care of that is simply to call us and talk to us about that. We will get you what you need. We'll prepare you so that way you can be a sales assassin, basically, when you go in there and have all the tools at your fingertips, or hopefully all the responses that you need when they start asking questions. Sandy,
right.
if you want to open that up for questions, or if anything you want
Thank
to
you
add.
very much, Chris and Sean, for sharing that wealth of information for us. If you don't mind, I'm thinking that we can share this PowerPoint, right, with some of the agencies and agents,
Of course.
or any pertinent information that you have, so we can actually send them, so if they can revisit that information. I will see some questions here, and then we go from there, okay? So we'll open it up for some questions, and let's see what we got on the questions. In one moment, okay? And question number one, on the traditionals that you mentioned, is on the Indiana, Texas, and was it Florida?
Florida, yes.
Are you open it up to other states, and when, like Oregon or any other states?
Right now, we do not have. We are kept very much in the dark. We waited very long to find out. When initially it was just Texas, and then it was released out to Indiana and Florida. I think for 12/1 effective dates. We were asking for that list of who's coming down the pipeline, and they're very quiet about that. So that we don't know. Honestly, we don't know. If I can find out what's coming down the pipeline, I will share that. But they are not sharing that information with us, or if and when it's going to expand again.
All right, and let's see what we have here. 1 second, because I have a question here that. One moment. Do we have a list of all states? Give me 1 second. This is available, and can that be sent to us? Well, I mean the groups. Do you have a list of all the states that this is available?
Everywhere except Hawaii.
Everywhere except Hawaii. All right. And finally, on for Sean, what is what is the largest of the group that you can write with the Ancillary product?
Sure, that would be up to 400 for either Beam or Nippon. So we can do either one.
Sean, if there is more than 400, if they run across a group that is more than 400, are you able to get an exception if it does cross that threshold?
I believe so. I haven't been asked anything over 400 yet. The only one I was potentially looked at was about 3,000, which clearly I wasn't going to get an exception for that one, unfortunately. But I can definitely reach out to our contacts at Beam or Nippon and see if they can accommodate that size. So, it's definitely a question I can ask. And I do believe so, especially with our relationships with them.
Perfect.
Great. Perfect. With that said, like I said before, this is a great opportunity for this is the renewal season for many companies. It's a great opportunity for you guys to seek out and service those companies that are having a really high rate. There are some companies that are getting out of the market on the traditional side, so this is a great opportunity for you guys to also target those as well. With that said, I want to say thank you very much to both Sean and Christopher for allowing us to present this information for you guys. If you haven't been contracted with Allstate benefit, please reach out to us at Western Marketing, and we'll be more than happy to get you guys set up and ready to go. If you have a census, don't hesitate to send it to us. We will run it. Even if you're not contracted, we can run both the contract and the census at the same time. Thank you very much, and have a blessed day. Thank you, John. Thank you, guys.
Thank you very much, everyone.
Thank you.